Chapter 8, Calculation of Oral Solid Doses. At the end of this chapter, you should be able to calculate solid oral medication doses using either ratio and proportion or dimensional analysis to convert equivalent measurements of oral solid doses between different units using different measurement systems and maintain patient safety. Keywords, make sure you look them over, but we should cover them throughout the chapter. Oral medications come in solid forms such as tablets and capsules, and liquid forms such as solutions and suspensions. Variations of solid forms such as powders and granules may be dissolved in liquid for administration. The oral route is the most frequently used due to convenience for the patient, safety, and reduced cost of administration and manufacturing. Oral medications are absorbed in the gastrointestinal tract, primarily in the small intestine. A prescription or medication order is written to accommodate individual differences due to age, weight, and concurrent medical conditions, among others. These differences must be considered by the physician and further checked and verified by the pharmacy professional as a means of checks and balances. Drug manufacturers provide drugs in different strengths to meet the needs of most patients. The pharmacy technician must be aware of the various strengths of medications and choose the correct drug strength to dispense. Calculation of exact doses and dosages is a critical factor in both dispensing and administering medications. Many drugs are prescribed in the exact amount found in stock, whereas others must be calculated. When the dose ordered is available in the ordered strength and form, no calculations are needed and fewer errors occur. Some tablets are scored to allow breaking them in half or even thirds. Medications that are not scored are generally not to be divided into smaller doses. Some tablets are enteric coated to delay release until they pass through the stomach to either prevent irritation of the stomach or avoid the inactivation of the medication by stomach acid. Enteric coated medication should never be divided, cut, crushed, or chewed. This rule also applies to most extended release over time formulations and delayed release formulations. Capsules should not be crushed, chewed, or divided, although a few can be opened and sprinkled on food for ease of administration. Be certain of the restrictions when calculating solid doses. The pharmacy technician must be sure to calculate the correct amount of medication to be given to the patient, both for an individual dose and the entire course of therapy. And this is something, as a side note, that I mean, this is pretty much going to be your entire job. So being able to understand this is not only crucial, but inevitable. So let's learn it. A dose is the amount of medicine to be given at one specific time, whereas dosage indicates the size, frequency, and number of doses of medication prescribed over a period of time. So also be sure that the medication name is correct because many medications have sound alike or look alike names. If there's ever a doubt about the medication to be used, or if the answer calculated is not what you expect, obtain clarification from the pharmacist. Practice that is always safe, important, and acceptable. So, a pharmacist is there to help you. They are who you always are going to go to when you have a doubt about something. It is not, uncommon to go to a pharmacist and be like, hey, before I enter this into, the prescription system, could you check my calculations? Or, hey, I'm not sure this answer is right. And that's very common. Obviously, they're not going to want to do that for every single prescription that comes about, but especially when you're learning, and if you straight up just can't figure stuff out, I mean, there's been times where I've been trying to figure something out and couldn't, and there's a line of people out the door and a million people in the drive-through, and I'm just like, hey, um, I really need you to figure this out for me and let me know. So they're there for you to help you. When it comes to things like that, you never have should never just Make your own judgment. If you don't know, you want to ask. They're ultimately the person responsible for dispensing the medication and would prefer to answer questions before medication preparation rather than make a medication error by dispensing incorrect dosages or medications. And the tech note here says, remember that dose refers to the amount of medication given at a single time. So the medication you're taking right then and there. Doses refers to the amount of medication to be filled for the entire order from a physician over a period of time. A helpful hint to remember this is the word dosage includes age, which refers to a period of time. Rules that should be considered when calculating medication doses follow. Most capsules are not meant to be open or divided. Scored tablets may be divided, but unscored tablets are not typically meant to be divided. Enteric-coated buccal and sublingual tablets, as well as most extended and delayed release capsules, are not intended for crushing, dividing, or chewing. Buccal and sublingual tablets should not be swallowed whole, but should be dissolved within the oral cavity in the designated location. So buccal is going to be in the cheek, sublingual is going to be under the tongue. If a part of a tablet, usually one half, is the answer to a dose problem, be sure dividing the tablet will not alter the pharmaceutical action. The calculations are correct and the correct medication and strength have been chosen. Single-step calculations are easily performed with the ratio and proportion method using cross multiplication and division. And this book recommends if you're doing multiple step to use dimensional analysis, but as you've heard me say a million times, I still will do ratio and proportion. In our tech alert up there says, always double check your calculations. If your answer seems incorrect, recalculate. So use your judgment when you're trying to figure something out. If it doesn't make sense, it's probably not right. So, think about what you're dispensing and how much you're dispensing, and if it's, higher or lower than you expect, or the answer is just crazy, definitely try it again. If the answer still does not seem correct, ask the pharmacist. Never fill an order or prescription if you have a question regarding the accuracy of your calculations. So calculating medication doses using ratio and proportion is going to be the same as what we just did in the previous chapters. But let's first write the relationships as fractional units. Note that the known dose, the dosage form are on the left side of the proportion, which really doesn't matter, but that's how they have it here. Either way, you'd get the right answer, just a side note. Um, book just tell you a lot to put it on one side. Remember that the units of the numerators must be the same and the units of the denominators must be the same since these are equivalent fractions. So that's something really important to remember there when using proportions. Whatever you have on the top is what you want to have on the bottom. So if you have a 250 milligram capsules available and you need a 500 milligram dose, this is how you would set it up. And this is read as follows. If there are 250 milligrams in one capsule, then there are 500 milligrams in X capsules. And that is what we would do to figure that problem out. We are going to go ahead and do example 8.1, which is the same type of problem.
Breath.
All right, example 8.1, a medication order is written for fluoxetine, which is Prozac, 80 milligrams, and the stock medication available is Prozac 40 milligram capsules. What is the dose to be given to the patient? So you can see here that they have the proportion already set up. So they have the stock on one side, which is this.
So 40 milligrams is one capsule of the stock. We want to give the patient 80 milligrams, and we're going to make sure that our units match across. And it doesn't matter if you wanted to like put the 80 over X here on this side or in the 48 over 1 here. It doesn't matter because they're equal to each other. All right, so we are gonna do exactly what they do and put 40x, and we get that by cross multiplying. So we have 40x is equal to 80 times 1. And they don't have the 1 there because it's just going to be 80. So that's what we would eliminate here. And we want to get x alone. That's what we're solving for. So to do that, we have to get rid of 40. So I'm going to divide both sides by 40. If I do here, I cross that out. Now I just have x. And then I just have to do 80 divided by 40. And that gives me 2 capsules. And you might be able to look at that and say, I don't really need to do a math problem. And if that's the case, perfect. Example 8.2, a medication order is written for 3/4 grains of codeine. In stock, we have 1/4 grain of codeine available. What is the dose to be given to the patient? So if you look at the example in the book, you can probably follow that and understand how they did it. I'm gonna do it a little bit differently because I think it's easier to work with decimals than instead of fractions. So first of all, I'm gonna take that 3/4 and turn that into a fraction or turn that into a decimal. And to do that, all I'm gonna do is do 3 divided by 4, and that's 0.75, and then 1/4. And you might not know these in your head, and if you do, that's great. 0.25. All right, so now I'm going to do a proportion with the stock strength, which is 0.25 grains. So I know I'm going to need grains here. And that's going to be 1 tablet. And we have an order for 0.75 grains. How many tabs? So we're going to do just like we did in the other example. We're going to go 0.25 x times 0.75 times 1, which we know is just 0.75. Now we want to get x alone, so we need to divide both sides by 0.25. And now we're just going to go 0.75 divided by 0.25. And that is going to give us 3 tablets.
Although DA is most useful when performing calculations with more than one step to keep track of units, it can also be used for single step calculations. To use DA, fractional units must allow for the cancellation of measurements from one fraction to the next. When orders are written in different measurement systems or units, DA is used to incorporate a conversion factor. So if you have 250 milligram capsules available and you need a 500 milligram dose, Start with the unit needed for the answer, which is capsules, and follow with an equal sign. Then use the known quantity with a unit as the numerator first. Follow with a fraction that will cancel the unit of the previous denominator and solve. So that's why I have the one cap there and the one on the bottom, which gives you two caps. The same way as doing it is a ratio and proportion, which is what example 8.3 and 8.4 are doing. So we just worked those out in example 8.1 and 8.2 using ratio and proportion. This is used doing the dimensional analysis. So again, you can look at the difference there and decide which, form you like to use best. I'm not going to work that out though. So that's the same with 8 point. Calculations involving different units of measurement. If the units of measurement differ, a conversion factor is required. This becomes a multi-step problem, which is better performed with PA. Again, you can use whatever version you're more comfortable with. And let's go ahead and do example 8.5.
For example 8.5, a physician orders metformin 1 gram, QAM, which we should know by now means every morning. Available stock is 500 milligrams. How many tablets are needed for one dose? This requires the use of a conversion factor between grams and milligrams. So by now, you probably heard me say that you should learn 1 gram is equal to 1,000 milligrams and remember it forever because you're going to need to know it. So true. So this 1 gram that they're ordering is really 1,000 milligrams. So we have our stock, which is 500 milligrams for one tablet. We need 1,000 milligrams. How many tablets? Again, if you can figure this out in your head, that's perfect. That's what you eventually want to be doing with things like this. But we'll work it out. So we cross multiply. So the 500 becomes 500x is equal to 1,000 times 1, which we know is just 1,000. And we want to get the x alone, so we're going to divide both sides by 500. So on the one side, we just have x. If I divide that by 500, I'm going to get 2 tabs.
Example 8.6, a physician orders phenobarbital, 1/2 grain, PID. Available stock is phenobarbital 15 milligram tablets. How many tablets are needed for one dose? So we first need to use the conversion factor between grains and milligrams, which is on your conversion sheet, also in the book. It is 1 grain is equal to 60 milligrams. That's the one that we're going to use for this problem. There's a few different variations, as you should see on that sheet. So I'm going to use that and put that on one side of our proportion. And then on the other side of the proportion, I am going to take this 1/2 grain and put that up here. Just so it is more easier for my brain to comprehend, I would convert that to a decimal. So hopefully you know that 1/2 is 0.5, but if you didn't, you could just do 1 divided by 2 and you would get 0.5 grains. And we want to know how many milligrams that is. So we would do 1x, which is x is equal to 60 times 0.5. We get out our calculator and we're going to do 60 times 0.5, which gives us that X is equal to 30 milligrams. So that's just the first part of the problem. And now we need to do the next step, which is finding out how the answer to the question that they're actually asking us. All right, so the available stock is 15 milligram tablets. So I'm going to do a proportion with one tab is equal to 15 milligrams. So then I know over here I need tabs, and down here I need milligrams. I have the 30 milligrams, which is what the doctor ordered, and X tabs. So and then I'm going to do 15X is equal to 1 times 30. I'm going to rewrite it because I know 1 times 30 is 30. Now I want to get X alone, so I'm going to divide each side by 15. I'm just left with X. And then 30 divided by 15, which gives me 2. So 2 tabs are needed per dose. Accurate calculations are essential for patient safety. Medication orders or prescriptions are the physician's determination of what medication and dosage should be safe for the patient. The physician, pharmacist, pharmacy technician, nurse, and other healthcare team members work together to ensure the safety. The patient is dependent on healthcare professionals to provide medications that are as risk-free as possible. To be certain that the medication and the dose are correct, follow the safety rules. Always recheck calculations after the dose has been determined. Learn and practice calculations until you are confident using them. If you have any calculation questions, check with the pharmacist. Remember that he or she is ultimately responsible. As you work from either a medication order or a prescription, verify that what you have on hand is the medication ordered and that it is in the dosage form required. Check labels 3 times before presenting the prescription to the pharmacist for verification, before taking the medication from the shelf, before preparing the medication, and before passing it to the pharmacist. Compare the label on the medication with the order from the physician. Be sure these are the same. Careful of look-alike and sound-alike medications. Do not allow yourself to be distracted. Keep your full attention on the task at hand. Know your medication and the average dose that is required for a patient of the age, gender, and weight of the person from whom the prescription or medication order is written. If in doubt, read the package insert or other reference material related to the specific medication before preparing it so that you are aware of the usual dose. Finally, remember that the pharmacist would rather have you ask a question than have the incorrect medication dispensed to the patient.